to be in Vermont right now, and hopefully it can stay that way. Just a few updates I wanted to share. As I mentioned, cases, deaths, and hospitalizations are again rising across the country. They did drop for a couple of weeks, and it was looking really encouraging, but kind of as expected, they are rising now with the reopening of schools and colleges and people starting to move back indoors. So as expected, they are rising. Worldwide, we've reached over 1 million deaths and 34 million cases. And I think that really, you know, at some point these numbers just become overwhelming. And I think there's certainly a sense of not really be able to comprehend what that looks like or what that means. I went on a website that just, I think it was a Washington Post website, and it was called Who Has Died from COVID? And it just has lists and lists of pictures and short stories and that, of course, you don't want to spend too much time there, but it does kind of put it more personal, which these numbers can get overwhelming pretty quickly. I wanted to just give a brief update on testing. And this is a little bit Vermont specific in that I'm not sure what Minnesota or Rhode Island are doing around testing, but there is still some confusion in testing. And this was evident in my hometown this week, where we had a positive case in one of the schools. The school closed down. The other schools, a lot of the kids didn't go because they were afraid. And it turned out that was an antigen test, an antibody test, and which was a rapid test done in the doctor's office. And then it didn't show up on the VDH website. And so there was a huge amount of confusion about why isn't it showing up. Everybody kept checking the website and it kept saying there's no cases in that county, even though it was all over the news. Should I go visit my participants right now if this is going on, and then how do we decide? So I just wanted to share that because I think I know that's the same thing that happened in other places around the state, and at the same time we have also been having actual positive cases in some of our buildings in Burlington. And again, we might not learn about it for a week. So how do we react to that, and how do we just manage all of this? Kind of also adding to some of the confusion, as I'm sure you've heard, the CDC, when we were talking on our last COVID call, the CDC had just issued guidance that yes, this virus is airborne, and then by the next day that had been removed, and no, it isn't airborne, and that was a mistake. So I kind of, when it went up there, everybody's like, well, yeah, we knew that already, and it wasn't a big deal. But as soon as it was taken off, it becomes a little bit bigger deal. It makes it, there's definitely some lack of confidence in the CDC at the moment among public health, and how do we manage all that? Certainly a lot in the news around vaccines and confidence around vaccines. It's sounding unlikely, especially in Vermont, that there will be any vaccines available until sometime in 2021. I've been hearing about distribution challenges, so that even if there is a vaccine available, how do we get it to people? How do we distribute it to people? One of the things that I was reading about is that it needs to be kept chilled at a lower temperature, or some of the trial vaccines right now have to be at a much lower temperature. So how do we get that to people in their building refrigerator trucks and that kind of stuff? So it's a hugely complicated process, and I'm sure we'll be hearing more about it. I'm not going to go, the voting information I think is going to be important to share with our participants, but I'm going to save that more for the, for Monday with the SASH coordinators. But I think it is important for us to be talking to our participants about voting because it seems like it's going to be confusing for some people this year. So we do have some guidance in the beat that I just wanted to draw your attention to so that we can help people with that process. So I'd love to hear from all of you. These are some questions I came up with, but certainly feel free to go off on any tangent you want to or anything else that's bothering you. Definitely curious about how your panel's doing. I'm spending a little bit of time with my panel in Orange East right now, and it was really fascinating to me how many people were just wearing masks who a month ago that was a big deal to them, and now it's just what they do and not a big deal. But at the same time, I was really shocked by how many of them had no interest at all in a flu shot and never have a flu shot, not doing it this year. I'd say about 25% of the people I talked to had no interest in a flu shot. So I thought that really shocked me. And I'm curious what you're worried, who you're worried about most on your panel, not names necessarily, but you know, who are the people you're most worried about and why, how your team is doing, and around social isolation and loneliness. Certainly we've heard loud and clear from everybody that that's a huge concern. And I'm wondering what you need. Dory, who is our SASH fellow, is working really hard on a presentation and trying to collect tools to help address those social isolation this fall and winter. But I'd love to hear from you if you have any specific needs. I wish we could come up with a magic formula. So if you know of one, share that too. And then anything else that you wanted to ask or share. So I'm going to turn it over to you and, oops, sorry, didn't mean to do that. Rita, why don't we start with you? I think you can unmute yourself.
Hi, everyone. So I've got to say on Monday, my new SASH coordinator started, and I'm very thankful and grateful to have her here. She came out with me this morning. I did my blood pressure clinic this morning. And just to have her sit there with her mask on and you know, introduced her to, and let her know that she really is not going to be up and running for several weeks, but know that she's here and people can call in and let us know for any concerns. On the 15th, I am doing a flu clinic at Windsor Village. I was asked to do that by the hospital, and we have 10 people signed up for it. And some people have already signed up and then crossed their names off because they went to Rite Aid to get it. So in blood pressure clinic today, that was our topic, the importance of getting a flu shot. And Molly actually, initially, I mean, in this community right now, the community is going to all the high schools, to the food banks, and giving flu shots. And initially, I was going to have 2 people come help me, one to sign in, one, you know, we have to have them sit for 15 minutes, and I would do the flu shot. And then, unfortunately, with all the other flu shots, I have no help. But Molly's going to come and help just fill out the paperwork. I can give the flu shot, and then that will be another opportunity for them to meet her. She did a fabulous job. She put her identification up with a picture. We posted that around the village and all the posters so people know she's here. And so things, I mean, it's been a tough last, 10 months now. But I think, you know, I'm just so excited to have some help. I will admit I'm behind on everything, and you know, but there were a lot of needs out here for patients. I mean, we have some people with diagnosed with cancer, several patients right now, somebody who left the SASH program and is in the hospital but will go to a nursing home, dealing with her son who has absolutely no doctor, no care, but is in desperate need of care. I managed to get him a doctor's appointment, and I will take him to that doctor's appointment on the 22nd. It's a Thursday. So I asked the hospital to please give me a Thursday, and I will bring him up so he can finally see a doctor. So I think, you know, for me, I just, and the people are doing good. They're going out, they're walking, with the blood pressure once a week, that's once a month, that's great. And then with Molly on board now, to have her to be meeting people. So I think we're on a good path, and people are doing good wearing their masks, and I think we're all in a good spot right now on our little panel. So, but I have to say it's been a very long 10 months, but I'm happy.
Great. Thanks, Rita. So I'm so glad that Molly's on board and getting started.
Yeah.
That's wonderful. That's wonderful. And it's great that you're able to do the flu shot. I've heard from 2 other wellness nurses that they were also doing flu shots. I know at least one of them was having trouble just getting the vaccine. Any idea? I assume you're getting it from the hospital?
The hospital's supplying me with everything. So I've got the forms to give out. They're going to supply me with the gloves. And the morning of that I have to pick up, I'll have to go up to the hospital to pick it up because it has to be on ice on a cooler. So right now I've got, I think it's either 10 or 12 people signed up. So that's a good number.
Yeah, great.
Yeah.
All right. Kathy, you want to go next? Kathy Schuster?
Hi. So actually, our flu clinic was held last Friday, and we partnered with Grace Cottage Clinic, and their staff came because we are also affiliated with an assisted living facility. So they were able to do them and also come to independent living and do a flu clinic, and we had about 10 people there. So that went well, and people were appreciative of that. I think that folks overall are doing really, I think, are in a groove. They're pretty on the mark with using their mask, and it's usually they just like, oh, I forgot, I'll go get it. So that's feeling a bit better for the majority. There are some that I still have to do all the garb because they don't, but that's a rarity. I think the people I'm most worried about are the people that I'm not seeing. We have a few right now, and they've really become extremely self-isolated and are extremely depressed. And I had a call this week, we did, because someone didn't even pick up their Meals on Wheels that was left or at their door. So those are the people I'm worried about. Those are the people that don't answer the phone or don't answer the door. And so the extreme depression and social isolation that is driving their world inward more and more, those are the people I worry about the most. I think, our team, Jesse and I are still working pretty much independently in that we have to work in separate space. We did have an outdoor meeting last week, so that was great that we were able to sit and talk outdoors to catch up. So that's really appreciated. And I think we're both, would welcome ideas on how to engage with folks either in the community or in independent living regarding supporting ideas regarding the isolation and loneliness. Because some of our folks are asking, like, oh, could we do something? A few could do Zoom, but not everybody can do Zoom. Our region just got connected to Comcast actually this week. That was a huge transformation in our valley. So I think, and I'm going to do an outdoor blood pressure clinic this week, weather permitting. So that's what's going on over at Townsend.
Great, thank you, Kathy. And you really bring up a really good point about the social isolation. We've been thinking about how to help people who are feeling more isolated during the pandemic, but certainly are people who have been deeply isolated for years and years. This is adding a layer, and that's a little different challenge than the other folks who maybe had more connection before the pandemic and are now suffering. But there's kind of 2 different problems, or 2 different layers to it anyway. So that's a great thing to bring up. Yeah. Thank you. All right, let's see. Melissa Stockholm? You're muted at the moment.
There we go.
There you go.
Okay. Yeah, so I'm in Addison County, and overall, think we're doing pretty well. There's still people that, forget to put their masks on, and that's pretty much been unchanged. I think there's some complacency. I'm back in the buildings for, like half days, and I feel good about those places because I've been able to get eyes on people with a hall visit. I am doing, still doing assessments mostly over the phone, but I will go in to do a quick visit and to get a blood pressure or work with this changeover of bubble packing since Marble Works and Wilcox Pharmacy closed and they're not bubble packing anymore. Or they're not, they closed, so we've had to make that shift. I'm concerned about all of the different panels, all 4 panels, and the community members who I don't always I haven't had eyes on. Even, some I have, but most I haven't had eyes on since COVID started. And we're calling and we're, touching bases that way, maybe even more than before, but I just miss that, that eye contact with a face-to-face visit. And, as we go into the winter, also worry about the social isolation with some of them in particular. I did hear I read something interesting yesterday, which about India, that in 1 month, their cases doubled from 300 million to 600 million in 1 month. And that was kind of, that was a little shocking when that, how highly transmissible it is. But flu clinics, Addison County Home Health was awarded a grant from the state to get flu vaccines to as many people in the county as possible. I think they have 300 vaccines, but they're not the high dose. And so I'm working to try to figure out how to get those clinics going in the buildings. Our building in Virgins has a clinic set up with Kinney Drugs next Thursday. They've done that several years, and Kinney Drugs, which is right behind the building, will come over, and I think 20 people have signed up for that. And we've been assured that they're going to have the high dose, but from what I'm hearing, it's not all that available. So we're trying to figure that part out with the other buildings, and hopefully, we can get as many people vaccinated as possible. But that's in the works. And I think the way it's going to work is, with our SASH participants, letting them know, asking them to check with their physician to see whether or not they can get the regular dose or if they really want them to have the high dose. And then the SASH participant can wait to see whether or not they can get it at a pharmacy, which I guess around here it's not that easy. And then if toward the end of October they still haven't had it, then offer our flu clinics. And that way they would at least get the regular vaccine. So that's kind of what's going on down here. It's still nice to have a little sunny and like changeable weather. We're still able to get out, so I'm glad about that. But, yeah.
Great. Thanks, Melissa.
Yeah.
And thanks for bringing up the question around the high dose vaccine. I did run into that as well, where I had one participant who didn't want to do the flu clinic because they were waiting for the high dose. And he's 103, so that makes sense. Like I said, I have heard the guidance from CDC is to get a flu shot, whatever is available. Personally, I'd like to wait for the nasal spray for my kids, but they don't know when and if that'll be available either. So It is a
think
good question for people to ask their doctors, I guess.
I would guess that, with whatever high dose is available, that those would be prioritized to hospital patients and nursing homes before the community. So one nurse had apparently gone to Walgreens in Middlebury and said that you have to make a reservation to get the flu shot, and you have to do it online. It's not just a walk-in like they're kind of advertising. So, and our home health hasn't been able to access either what they've purchased themselves normally to get any of the high dose, or this grant. There's 2 buckets that they're working on, and without the high dose. So and the clinic in Virgins last year, people were pretty upset because I guess kidneys came with the regular dose, and they thought they were going to get the high dose, and they didn't, and they weren't told it was going to be the regular dose. So they're like all uptight about, I don't want to get it unless it's the high dose. And so, that's the way we've kind of figured it is, to check with your doctor first. And if you are going to wait, don't wait too much longer than toward the end of October. And then that's when we'll come in and try to get these clinics going if they haven't gotten it by then. So.
Yeah, great. I would think that if home health can't get the high dose, I'm not sure, you would think that would be some of the highest risk people.
Yeah.
Yeah. All right. Thanks, Melissa.
Mm-hmm.
Christina, go next.
Here. Okay. Yes.
There you go.
So I have all the same concerns as my colleagues. I'll just add that, truthfully, much of my concern is the unrest and the fear about the upcoming election. I'm hearing that from everyone that I see, and that's a toughie, obviously. I mean, yes, everybody's concerned about COVID and being isolated, confined to their apartments more, et cetera, but primarily people are afraid with the upcoming election. They're afraid of rioting. Some have said they're afraid to go to the polls. I know in Vermont, the ballots are being mailed. Some of the towns are asking people to actually walk their ballots in, deliver them. So that, that is truthfully my biggest concern over COVID right at the moment. And I've been trying to reassure people that, there'll be law enforcement and all of that available at, on election day. But they're actually frightened. I think overall, I don't know of any cases in my 2 buildings. I know someone was tested this morning. She asked me not to say anything until she gets her test results back. And she will let us know. And then we'll proceed accordingly. And the social isolation, loneliness, that's just running rampant, and it isn't even winter yet. So, and I've been coming to work all through the pandemic, so I'm not doing anything any differently. But yeah, that's where I am in my 2 buildings, one in Burlington, one in Shelburne.
All right. Thanks, Kristen. And I think, it's hard. So many of our participants spend a lot of time in front of the television, and it's really hard to not be anxious about November. So,
and I've encouraged them to limit, like maybe an hour or whatever, but the rub is between what they want to know what's going on and what they're hearing, is frightening for them. So Yeah.
Yeah, absolutely. And they feel very powerless, I'm sure. I mean,
Right.
even more so perhaps than younger people who could go somewhere safe, or, you know, I'm sure they feel pretty powerless.
Yeah.
Okay. Amanda.
Hi.
Hi, Amanda.
Thank you. So our panel is doing okay. We actually counted it today and it was a little bit lower. We have a lot of people that aren't answering their phone or calling me back for reassessments. Same with the SASH coordinator. We're having a hard time locating some people. We are planning a flu clinic next week. I'm going to go the same time that the people are coming to get their commodities. So I'm going to sit outside with a picnic table. I'm asking people to sign up this week who's coming. I fortunately work for VNA, so I'm able to get vaccinations from them. They're going to be bringing them down from Rutland. And we have the quadrivalent high dose also. We have both, so that's a good option. What am I most worried about, or who? I think it's the people that don't take the pandemic seriously. We have had problems in our building with some kind of get-togethers outside, out of our hours at nighttime. There's a kind of a big party group because we have a lot of young people in our building also. So that's kind of worrisome. We've talked to them about it, and I've put signs up and I've called my people, but people just don't take it seriously. So that worries me. I'm trying to go into the building at least 4 hours a week. I'm only 8 hours. So I'm trying to go in 2 hours on Tuesday and 2 hours on Thursday. I don't go in the same time as the SASH coordinator. And then I don't let anyone in the office. The housing has actually built me a plastic shield that goes right into the door. So I can still see people come up to the door, but they don't come into the office. So I love that. And then I can talk to them. We will put our masks on and I talk to them through that big kind of panel. So that's nice. What else? Nothing really. I have a personal experience with COVID that I'd like to share that's kind of interesting. My husband actually tested positive at the beginning of September. His only symptom was loss of smell. And so he's like, oh, that's strange. Like no other symptom except for loss of smell. So we went and got tested and he was positive. And then he developed just like a dry cough after that. But he worked from home every day. He's a state trooper, detective, and he was able to work at home every day. He has no idea where he got it from. The contact tracer actually called him, and he only cared about people that he was with for 15 minutes or more, and close to them for 6 feet, and no one met that qualification. Even if he was with someone for 5 minutes and had no masks on, he didn't even ask about masks. He didn't care about that. He only said we only had to tell people if he was with them for 15 minutes and 6 feet from them. So I thought that was very interesting. So I, of course, had to get tested, and my kids, and we had to quarantine from him in the house, which was very interesting. Had to get his own bathroom. He wasn't allowed in the kitchen. He sat out on the porch like the whole time, so it was nice that it was lucky it was nice out. And if he went into the house, he had to wear a mask, and then he slept in the old bedroom by himself. So I and the kids, we all tested negative. And then I had to get tested 7 days after I last had contact with him. And then I was negative. We all negative again. And then, so that was quite interesting. That was my experience. And his only symptom was loss of smell and a dry cough. So, yeah. That's it. Any questions?
Thank you for sharing that, Amanda.
Yeah.
I'm glad he's okay and you guys all were okay. I am, one of the things that I think personally is interesting or is a question is how do you, like how does your social network respond? Are they supportive? Did you tell anybody? How did you handle that?
So all my family lives out of town. And of course, everyone was calling every day and seeing how he was doing. The hardest part for him is he was the first state trooper in the state to test positive. So of course the governor had to know, and he had to do all the contact tracing, and then had a doctor call him every day, see how his symptoms were. But he was able to exercise every day. He's like a marathon runner, and he was able to do all that. And so they were pretty shocked that he had no other symptoms. But like my daughter had played with someone outside, and so they were all worried, and they went and got their daughter tested, but she didn't meet the qualifications according to the contact tracer. And then her job wouldn't let her work until her daughter came back negative. So a lot of scare. A lot of people were scared because, like, my neighbor's dog licked Jesse in the face. And so my neighbor was scared and wanted to go get her dogs tested. So there was a lot of fear, especially around my neighbors. But luckily no one was positive except for my husband. And and he doesn't really go out much. He's been working from home since COVID. They have all the detectives working from home, and once in a while he goes out for an interview. And so we have no idea. I don't know.
Amanda, I had a question, and now I have a couple.
Sure.
One, I didn't know you could get dogs tested. Like, is that really a thing?
Yeah, well, no one would do it for her, but she called all around and no one would do it for her, but she was very, very scared that they got it.
Never thought of that. So that was just really interesting.
Yeah.
And then the other thing, I guess a thought and a question. So my thought was my brother-in-law's parents, father and mother-in-law, his mother-in-law's a nurse, and she had contracted it at work, and the father-in-law never got it. They lived in the same house. She tested positive for like a solid 4 weeks, and they did not separate from each other like it sounds like you did. And never got it, which was always very interesting to me. But my question was, when the contract tracers called, you said they were very specific about 15 minutes or more and no closer than 6 feet. So if he had spent an hour with someone, as long as they were 6 feet away, that wouldn't have mattered.
Yep. So, and the guy didn't even care about a mask. So that wasn't even a question. So if he was with someone, like he went to a death scene and he was with someone and they were both wearing masks and he was with them for more than 15 minutes, that guy had to get tested. Even though the other guy was wearing an N95 mask, that guy counted as someone that had to get tested because they were with each other for more than 15 minutes.
It actually was personal.
And there was someone, he went and got his hair cut by someone, a state trooper that cuts people's hair in his house. And he was like close contact with them for only like 8 minutes. That guy didn't count because it was less than 15 minutes. So I thought that was very interesting.
So much so. I just read my daughter's school opening plan, and in reading it, they were talking about what they're going to do if there's a positive case. And it occurred to me in reading this that if the teacher was positive, those kids were not going to be contact traced because they're keeping the teacher 6 feet away. So even though they've been in a room with them for 90 minutes, they would probably not fall under the contact tracing. But that seems rings true with what you're saying too.
Yep.
I want to have
but it's contradicting because my husband wasn't with anyone for more than, like, anyone that was positive for more than 15 minutes, so whoever he got it from it was less than 15 minutes. I mean, he had gone up to Burlington. He's thinking, like, I pumped gas, like, could something have been on there? And then I maybe ate something in the car afterwards. Like, he doesn't know. We went to Chili's one night and he's like, and he opened the door for everyone. So he was like, maybe I got it there. Like, you don't know. So that was interesting.
Thank you
But,
so much for sharing that
but
story.
we didn't get it. I mean, I had close contact with him when he supposedly would have been the highest way to spread it, like the highest time. And I didn't get it. So
Thank you so much for sharing.
yeah, you're welcome.
Amanda, I had a question. Was that was done with a PCR test? Was it an
It was the 2-day one, whatever. I get them confused. Which one's the rapid?
That's the antigen.
No,
Yeah.
I got it done at our hospital where they stick it way up your nose. So I had to get, so my work requires us to get a test every month, VNA does, because we go to nursing homes for hospice. And so I had just gotten a test like 10 days before that. But I had to get 2 more tests. Awful. Hate it. Yeah. Right at our hospital. It's really easy to do. And one interesting thing is when I told my work VNA that he was positive, they said, well, as long as you're not showing symptoms, you can come into work. And I'm like, that doesn't seem right. I mean, I haven't even gotten tested again and he's positive. So I'll call my doctor and she's like, no way. And so I had to write a doctor's note. I had to have the doctor write a note, the reason why that I needed the 2 tests. And she's like, even though healthcare professionals are around people all the time, that might have it, you had close contact with him. He's not one of your patients. You weren't wearing a mask or anything. You had close contact with him. So of course you have to stay quarantined. I was like, I thought so. That's, so I think they were wrong with telling me that. Yeah. Because there was no way that if I went into a patient's house and said, yeah, my husband's quarantining at home with COVID right now, they would be like, get out of here. There's no way they'd have me in there, no matter what protection I had on. So I thought that was quite interesting.
Any other questions for Amanda? All right. Thank you,
All right,
Amanda.
thank you. I'm going to go now. I have to go see some VNA patients.
Okay.
Thanks. Bye.
Jenna? Bye.
Hello.
Hi, Jenna.
Put my video on. There we go. Hi. So, yeah, our panels are, doing pretty well overall. Right now, it's just Shauna and I, so just the / implementation manager and myself. So, it's just been, that affects, of course, our work with participants. But overall, we're doing pretty well. There's a lot of coordination of care and working with partners, which has been great. And yeah, the new normal. I would say we have a range of where participants are at. We have some participants who have been very angry actually about all the regulations and preventive measures and like feeling like their rights are being taken from them. So it's been this ongoing discussion with them, giving them support and talking to them about, of course, the importance of preventive measures. And so some people have been more complacent, whereas then you go to the other side and there's some people who are, haven't really left their home or gone fresh air, who are just have a lot of fear and anxiety and stress. So it's just, working with people in many different places, where they are. So it's kind of all over. But I would say we're doing okay overall. I wasn't able to be at the last call in September on the 17th. But we did have a positive COVID case. It was our first one. It was an isolate case. There was not contact tracing. that was done. But this individual had multiple other things going on besides COVID-19 and being positive. But we just worked, with this person the best we could. They're much better right now. And now we're just trying to get all these other services in place for them, for other issues that are going on. But it really hit more home, because someone that, I was actually supposed to go in the day that we found out they tested positive. I was going to do an in-person visit. So it just hit a little bit more close. But we haven't had any other cases. And with the flu vaccine, so the VNA actually is doing a lot, it sounds like, with the expansion of the flu vaccines, which is really great. I know that OneCare and Vermont Blueprint, they've been brainstorming a lot about different ideas for the expansion of flu vaccines, and possibly whatever we come up with now, we could use that for when we have the other vaccines for COVID-19. And what one of our primary care offices actually is doing a drive-through. So they've opened that up and they're doing that every week. I don't know the length of time right now. I'm assuming it's at least going to be through October, possibly early November. But that's great. That's very helpful, as well as the VNA who will go in to give flu vaccines. And a lot of people are. So I've been getting a lot of calls like, where can I go? Where should I go? So that's been great. Just trying to get people to get those. And just trying to think, we've had some acute cases too, not related to COVID-19 at all. Some in regards to mental health and trying to get them services, a couple people more in crisis. We have other people who've had some physical issues, limitations. It seems like we're putting more in for choices for care applications, people just needing more care in their home to stay independent in their home. And one person going to a nursing home who's there, and also a couple people that are thinking about assisted living. And so just kind of working with them during that transition period. One thing I will share, which was interesting. So since COVID-19, we had a pharmacy in town who was supplying bubble packs, and they also delivered, which was incredibly helpful for so many participants. And now they're not since COVID-19. So, and they've been doing the punch packs, but a lot of people are finding difficulty with those. So for some participants, I was able to, so from my understanding, BIATA or the VNH really was not doing medication management. It wasn't reimbursed. But I found a way where if it's ordered, if med management is ordered and they're a Medicare beneficiary, as long as there's a secondary order with it. So for example, you could do med management with education if someone has heart disease or diabetes. And so as long as there's another piece, they may be able to get some coverage for a shorter period of time. But I know that we've had a couple participants where it's been very helpful that went through. So that's another thing. It's just this med management, trying to figure that out of how that's, going forward, if pharmacies are still going to continue to not do bubble packs. So I've been talking to a lot of people about that. And let's see, the isolation, social isolation, the loneliness, that's definitely been an issue. We have at one of our panels, one of our building sites, I know it's coming up a lot where, they're really wanting the community room to be open, wanting, more activities, or having more of the freedom to be able to go in there with a group of people. So it's just really hearing their concerns, also trying to go by regulations and keeping them safe. But I know that it's been really tough for most people with the isolation. and also just people feeling more anxious and stressed. And there's so much going on right now in our country besides COVID-19. And so just those fears that come up. And one thing that I found to be quite helpful for a lot of them, sometimes it's just they want an interaction with somebody that can help in grounding them, anything to help with their stress. So I have a couple participants where doing like breathing exercises that we'll do together has been really helpful. So anything to manage that stress level and just bring it like into the moment, like right now when you're with them, because that's where we're at, you know, is just those moments that we have with them. So, and they've been taking that and utilizing some of those tools and strategies for when they are feeling more stressed. And it's been actually for, I know a few of them at least that I hear back from quite often that it's been helpful. So just trying to work with people, just individualizing a good plan for them. And I think still brainstorming about what this winter is going to look like. Of course, it's hard to know right now. I wish we knew, but I think just taking it day by day and just keep brainstorming, you know, ways that we can help people. I know one barrier. So, you know, there's a lot of programs right now, use, you know, technology based on the computer, and they're great. But for a lot of participants, that is a barrier, just not knowing how to use the technology or not having the technology to be able to utilize those programs. So I don't know, it'd be great if if everybody could be set up with technology, but for those that can, I think that's going to be very helpful. Let's see. And trying to think if there's anything else. I don't think so right now. I think we're, you know, doing pretty good overall, and yeah.
Thanks, Jenna, and thanks for sharing about the breathing exercises. I think, you know, sometimes we look for some big solution, and just being present for a few minutes might be the best that we can do right now. With you know, we can't solve everything that's going on, both with COVID or in the world,
Right.
but we can be present for a minute. So thanks for sharing that.
Yeah, sure. Thank you.
Jenna, did they say why they were no longer doing bubble packs?
They said, I guess the way that they put them together, they have to be in close contact with each other when they're actually producing the bubble packs. So that's what they decided not to. And I guess the punch packs are different. I'm not sure how, but.
Jenna, where are you located?
Oh, sorry, I'm in Brattleboro area.
Because Rutland Pharmacy does bubble packing.
Okay. And
we had two Marble Works in Middlebury, Virgins, Bristol. They were bought out by Walgreens, and then Wilcox Pharmacy in Rutland was bought out by Walgreens. So we were scrambling, and Freedom Pharmacy in Burlington bubble packs, and Rutland Pharmacy also bubble packs.
yeah.
And they'll send it out, and it's free.
Oh,
So,
wow. Okay,
yeah.
and they'll send that all the way, they'll mail it
Mhm.
to them?
Yep.
Yep.
Yeah. I was
Okay.
just going to mention Freedom. Thank you, Melissa. I was trying to rack my brain for what that one was called.
Thank you, that's very helpful. Yeah, we have like one of our pharmacies, actually Rite Aid, they will do bubble packs, but they won't deliver. So that was kind of an issue there. But thank you, this is a great resource. So
two other places, Kinney Drugs. I don't know if you have one down your way.
oh yeah,
Okay, they blister pack, but their distribution center in Waterbury will bubble pack. There's a form that has to be filled out. And then there's an online company I know we had a former participant use called Pill Pack. And it was like a box that came in the mail, and the pills were in a little plastic package on a roll. So you pull out, the first one out would be, today AM and then the next one, and it's just on this big roll. So that's another option.
Yeah, thank you. I know actually about PillPack. I have one participant who uses it, but we found a lot of difficulty with that because, you know, if they like say a med change, you know, happens in the middle of the month, they won't send out new packets until the next month, the first of the month. So it was a little bit tricky. But you know, it's good if someone's very stable, they've had the same medication, there's not a lot of changes. Yeah, that might work. Thank you.
Yeah. I've heard that, I mean, I've worked with Rutland a little bit and they seem really great to work with, and Freedom as well. So you know, personal experience that they seem like they're pretty good to work with.
Okay, great. Thank you.
Okay. Thanks, Jenna. It is just about 2 o'clock. I noticed that Kathy just joined us. If anybody has to jump off, please feel free. But if you want to just give us a check-in, that would be great. And I don't think I missed anybody else. It's a little hard to see who all is on here, but.
Yeah, my apologies. The time change was on my calendar wrong, so I totally spaced out. This was noon instead of 1, so there we go. Here I thought it was early. Anyway.
That's okay.
I have nothing to report. I'm just very sad I missed hearing this. So next time I'll get it on the calendar the right way as we switch to Zoom now. Only got that figured out.
Okay. And I don't know, Ashley, were we able to record this or not?
We were. Joanne was able to.
Oh, good.
Awesome. Great. So it is going to be recorded and we'll put it up on Star.
Good.
And we're all learning about this Zoom, so
yeah,
we'll get it figured out. Right. All right. Thank you, everybody. And I'll set up another call in a couple of weeks.
Okay, thank you.